I don't recommend it, I really advertise it. I mean, maybe we get together at a wedding or something and hey, you're so fucked up and stuff. Yes, but look, and I bend down and stand up, and I bend down and stand up, and I say, this is just a device I've been treated with that makes you feel good.
Hi, my name is Maria Gonzalez and I am physiotherapist. José Luis Guadalupe is a patient that I want to share because he is a patient I know. From the first sessions that I was able to deal with as a physiotherapist, I have treated him for different pathologies, and this last time, which is the one I'm going to tell you about, it's the one I'm going to tell you about. He comes to me in desperation because he has several abdominal pain following a fall, but that his family doctor, whom he loves because she helps him a lot in his day-to-day, is not able to help him and is not able to realize to whom she should refer him. We start and I explain what may be happening to him. It seems to be a neuropathy, since it's a long-term pain and it's no longer related to that abdominal tissue. An ultrasound is carried out in his abdominal musculature and all structures are correct. I explain that it is probably a problem in the electrical conduction, and it is also associated with a very important emotional traumatic process that causes the patient to fall into a very low anemic state, bordering on depression. I explain him, because I think it is important that he understands what is happening to him, how he cannot separate the processes. And then I propose the treatment with Nesa's microcurrents that will play an important role, although they will be associated with a certain treatment. We will do isolated in the booth with other technologies and other manual therapy.
Good afternoon. My name is José Luis Guadalupe. I came here because I suddenly suffered from quite severe abdominal pain. And neither the family doctor nor at Hospital de la Fe, they could not find a way to find out what was wrong with me. I had just gone through a major personal trauma. Right after that trauma, I had fall in which I fractured 4 ribs on one side and a rib and a vertebra on the other. That was all we needed. And then I got out of that mishap, which would last about a month. And I already started with abdominal pain, but wild. In other words, a pain that lasted day, night, afternoon. I could neither eat nor walk. I couldn't get into bed for a month and a half. I had to. Well, no way. To get me into a car, it took 2 people. So I was already really frightened about that. Because no one, not even the family doctor. I have a good doctor, by the way, because I didn't know what to do anymore.
He starts, and we set, as usual, some objectives, we carry out some validated questionnaires, we make a wee cardio, as every one of our patients. We treat with Nesa, following a protocol, and in those goals, between the 2 of us we set improving his abdominal pain. That does not allow him to move, it does not allow him to get into a car, it does not allow him to have a social life, it really has him distressed. To improve his mood, improve his sleep, which he does not tell me, but I ask him. And as a secondary objective after a few sessions is the improvement of the urinary incontinence he suffers from. In the progression of the treatment, we approach one objective after the other with the different programs and the different locations of a directional electrode. And we are improving the patient's general condition. The reduction of pain improves his mood or vice versa. We do not know, since it is almost simultaneous, and he refers, especially in functionality, a time when he can get into a car or when he suddenly gets up from the stretcher and says, "I'm cured, it doesn't hurt." He always expresses himself this way. He usually expresses himself this way. He improved his sleep, and today he has improved as well, and he considers himself cured of urinary tract incontinence, which also greatly reduced his quality of life. We are explaining to him that he is not cured, that it is an adaptation by his autonomic nervous system, which logically we are balancing his nervous system. But in the long term, if he wants a quality of life, as he is achieving, he will need to take his maintenance sessions. He is delighted. He is one of the patients who would come every day to the clinic, because right now it's when he starts to feel like having a normal life again.
So, I started therapy. It doesn't hurt, it doesn't itch, or anything like that. They simply plug you into the machine and that's it. And after the 4th session, because I was going to do 10 sessions, in the 4th session I was able to get out of the car by myself. And already my brother, who always brought me, said, "This has started to get better." I say, it has started to get better at this point, because until I have not been able to get in the car by myself, no, I didn't realize it. And I started to get better. My family doctor was more concerned than I was. She was curious about it, because she didn't know what to give me anymore, because there were 4 painkillers, every 4 hours, 4 painkillers at night and during the day. I could not walk. Well, it was something horrible. Horrible. I can't tell you about it. And I started to get better and better. And well, 4 days later, I was walking, I was bending down, that was unthinkable. I would bend down, stand up. And everyone, my whole environment, let's say, was very attentive to me. My family, they just couldn't believe it. Because even my doctor told me, "This looks like a miracle." Well, I had one very important thing. And it was that I also had an incredible urinary incontinence. And since the day before yesterday, I no longer have any. Let me explain you what this might actually be. I think we have a wool skein there, with many traces of wool coming out, and when a big thing happens to us, as it has happened to me, they get tangled up. But I notice, well, just that. I'm leaving, and when I'm coming home I'm already better. And maybe my brother will call me. "How are you today?" "Wow, just great. Now we are all going to have lunch every week, and look, something I got out of this." And well, very well, I am very happy, to be honest. Well, I think I've made myself clear. The best I could within, I don't know, my possibilities. And well, if anyone needs or has anything similar to what I have had, and as far as I can see quite a few people suffer from it, as I predict nowadays, well, I advise you to do so. I seriously advise you to do so. Because it's not silly, it's not a little pain that goes away, and that's it. Well, I say goodbye to whoever is listening or watching me.